If painful dentures or your teeth prevent you from enjoying one of life's great pleasures, like eating great food, David & Associates offers a solution, a life-changing procedure called Teeth in a Day. Come to David & Associates in the morning for implants and leave with permanent teeth the same day.
Life's too short not to enjoy it. Call David & Associates for a free consultation on a revolutionary procedure that can give you a dazzling smile and change your life. Hello, I'm Dr. Joel David of David & Associates Center for Cosmetic and Implant Dentistry. If you're suffering from an ill-fitting denture or many broken teeth, you're going to be excited about this program. In a minute, I'm going to introduce you to some of the dentists of David & Associates, and we're going to show you how your problems can be a thing of the past. What you may not realize is how many life-changing and affordable options you have with modern cosmetic and implant dentistry. First, I'd like to introduce you to some of the doctors of David & Associates. After you watch this show, no matter what option you decide is best for you, we'll accomplish two goals: beautiful aesthetics and incredible function because of the use of dental implants. Today, I'm honored to show you an actual patient that I helped with a Swiss dent overdenture system. Angela came to my office, as you'll see, wearing an ill-fitting denture. She told me she was humiliated to go out in public because of how she looked. So I'd like to have our staff discuss what is an overdenture and what is the secrets of the Swiss dent overdenture system on setting and designing a beautiful smile just for you, as you'll see in Angela's case.
You are witnessing this beautiful young lady transform from wearing an unattractive, ill-fitting denture to a beautiful smile supported by dental implants. Imagine this being you. Our Teeth in a Day program will miraculously give you permanent teeth the same day. At David & Associates, everyone can enjoy a beautiful smile, properly eat food without pain. Call David & Associates and get started with a free consultation and CT scan and enjoy life to the fullest. Call David & Associates and get started today.
You know, we're coming to, I think, the most exciting portion of the program. We're going to actually show you different options you have at David & Associates if you have denture problems or many broken teeth. So the first option we're going to show you is called the Swiss dent overdenture system. This is a tissue-based restoration where we're going to make a superb restoration that gives back the patients a beautiful smile and incredible function. And what this restoration is we're making a restoration that plugs into implants using a locator attachment. So I'd like to introduce you to some of the doctors of David & Associates, and then we're going to show you a patient that I actually just finished, and we're going to show you what we accomplished with this patient. And we're going to go over how we gave her a beautiful smile, what we looked for and how we created the smile, and then what kind of attachment we used as far as creating the Swiss dent overdenture system. So, Dr. Phillips, explain, what is the Swiss dent overdenture system?
Well, the Swiss dent really applies to almost a way of thinking about making a denture. We take great pains to evaluate each patient as an individual, starting off with what kind of cosmetics they're looking for, the shape of the smile, how large are the teeth, small are the teeth. We'll match the shape of the patient's face. If, let's say, they're a very strong Army sergeant with a square jaw, we can match that to the shape of their face and make sure that it's the way they want it to look. We do try-ins with these teeth set in a wax rim. In that wax rim, we can make those fine little adjustments we need to make it the way our patients want things to look. We can base that on maybe how they looked in the past to reestablish their look of a more youthful time. Basically, our patients, everyone's an individual. We try to learn more about them and see what they're looking for and try to meet their needs with the look of this.
You know, Dr. Burbank, as we were looking at the photos of Angela, go over about, what the vertical dimension is. You know, one of the classic problems we have with dentures is the overclosed, the look that really ages a patient. So explain how we accomplished this dramatic change with Angela on her facial profile.
Well, vertical dimension refers to the distance between the upper and lower jaws. And that is in a very specific distance that is maintained by the presence of the teeth. So we lose the teeth and we lose that distance. And if the dentures then are made on a patient with no teeth at this incorrect vertical dimension, then the lips can look droopy, or even the upper lip can be closed in and not supported. And as you say, make the patient look older and not able to function as well. And with this technique, we can moderate that and adjust that.
You know, I've been doing the Swiss dent technique for almost 20 years, or at least 20 years. And I've had a lot of patients tell me that people who looked at them after we've done a case like this, that they've actually patients of patients' friends have thought they've had cosmetic surgery. And so that's what we're trying to create. We're trying to create incredible function, incredible aesthetics. So, you know, one of the ways we create the function is we use the locator attachment. Explain what the locator attachment is and the advantages of the locator attachment.
Well, the locator attachment is one type of attachment used for a removable implant overdenture. So we utilize the implants, and the patient still gets a removable appliance. And with that removable appliance, it allows them to get that lip support that they need. And it gives them the ability for easier hygiene. Some patients like to have that removable appliance, but the locator attachment is a very low profile attachment. It gives them a lot of space, so we don't have to have these big bulky appliances like they have in the past. The patients adapt to them very easy, and it creates a beautiful prosthesis that the patients can function with and smile with. It's a beautiful prosthesis.
You know, if you're interested in any of these options, you know, at David & Associates, you can call us for a free consultation. It includes a free CT scan. You'll meet the surgeon, the specialist. We'll go over all your options. So we'll tell you what's available to you. Do you need any bone grafts? You'll be given literally every option in implant dentistry, from either a removable Swiss dent to teeth in the day, or we actually do cementable custom bridges, custom fabricated by our laboratory technologists. So at our office, you'll literally have every option available in implant dentistry. So now what we're going to go to is a case presentation, and you're going to see two actual patients we've done. You're going to see the planning that's involved in this and how the patient literally goes out. When they come in our office about 8 o'clock in the morning, they're going to leave about 2 to 3 o'clock in the afternoon with permanent teeth in one day. So Dr. Jovic will open this case presentation. I'd like to go over how we do the Swiss dent overdenture system with implants. Today you're going to actually see a patient. We're just finishing her case literally today, where we placed upper and lower implants, and then what we've done is we've made the Swiss dent denture system that actually plugs into these implants. The advantage of this system is with the implants you can literally chew the way you want to chew, like when you had your natural teeth, because we're going to look at your facial profile. We're going to look at how we want to build your lip up, how we want your lip support to be. It almost looks like we've done cosmetic surgery, but it's without surgery. It looks that good. Now what you're going to see, and we see a lot of this when people have dentures, is the teeth aren't set like real teeth. So for Angela, bite down, Angela, for a second, and just show how you close, and with your lips touching, and bite all the way down. If you look, Angela is overclosed. She's a young person, but what we see with a typical denture, if it's not fabricated correctly, if it's overclosed, a denture can really aid you, because when you measure from the tip of the nose to the chin, there is what's called a vertical dimension. And if it's overclosed, a denture system can really aid you. So you're going to see when we did the Swiss dent overdenture system, we opened up Angela's bite. We also, if you look, Angela, just relax and close, please. You're going to see for somebody this age, which is a young person, her face is collapsed, because if you don't pay attention to how the facial profile should look after you lose the teeth, and the laboratory technician doesn't get the proper information to place the teeth, they'll always place the teeth over the remaining bone. And what happens many times is the whole face collapses, and that's why a denture can literally age you 10 to 15 years. That's what we're seeing here. We've got a denture system that's overclosed, that's aging her because it's making her cheeks collapse. We have a denture system that's not taking into account that the bone is collapsed, so her lip is too far back, and that's aging her. Also, if you look, Angela, smile if you would. You see how the teeth, if you look, the teeth are set flat. 90% of the patients that come in, when they present to me, either they want a custom denture or they want a Swiss dent overdenture system with implants, the teeth aren't appropriate for the size or the sex or the age of the patient. So you're going to see what a difference it makes if we use the proper teeth, and then we also give the proper profile to the patient. And that's what you're going to see on the new denture system. So what I've done is I've inserted the upper Swiss dent denture system to the implants, and now what I'm doing is placing the lower Swiss dent, and what's going to happen, it actually plugs into the implants, and it plugs in so tight we almost can't get it out of the mouth. Let's see the dramatic change we have. What gives you a beautiful smile is you want to show all the teeth, you want to have most of all the teeth showing, but never the plastic. So when a lot of people come in with denture systems, one of the mistakes it's making is when they smile, and if you have a denture, you might have a denture that has this. Every time you smile, the plastic shows, and it's a dead giveaway that you have artificial teeth or a denture. So there's a way of measuring the high smile line that when you smile, you're never going to show the plastic, but you're going to show the Swiss dent teeth. Just look at the difference we've made in the cheek. So we've stretched the bite. We went back to how she was naturally had her vertical dimension, which she had her natural teeth. So now she's not overclosed. What's nice with the Swiss dent denture system is we do a lot of fillers with Juvederm and Restylane in our office. And when we do Juvederm and Restylane, it lasts about 8 or 9 months, and then we have to do it over again. What's nice with this system is we can build up the facial profile, and it never goes away. And that's why we call it a non-surgical facelift, because we can really alter the facial profile, and it never goes away. You know, one of the things I want to show is, you know, with the best fitting denture, with the biting studies that we've talked about, you maybe get 20% of the chewing power if you've got ideal bone. So I want to show on Angela how tight we can actually make this. This is what we're trying to accomplish. I'm actually going, that's how tight this restoration is. This is why you can eat corn on the cob, steak, any kind of food you want, because this thing won't move. If you have a lower denture, you know how one of the hardest things to fabricate for a patient is a lower denture, because at least with an upper denture, you get a little bit of suction. But on a lower denture, because of the anatomy, all you really have is a little U-shaped piece of bone. We have patients that come in with multiple lower dentures that never fit. This is the lower denture. This is the lower, and this is how tight this overdenture is. So we've got 2 restorations that we've made for Angela. That's how tight it is. So you're going to finally get to see what we've been trying to accomplish for you over a little bit of time, and I think this is going to be an exciting moment for you. So are you ready?
Yes, I am.
Let's take a look.
Oh my gosh.
Beautiful smile, isn't it?
Yes.
Yeah. You've been telling me, I think you lost your teeth in your 20s. And
8 years.
8 years. And so now we're going to go back to the time when you had the chewing power of your real teeth.
Wow.
So I think it looks beautiful.
Yes, I'm excited.
Yeah. So far, you know, what you've seen is an overdenture. Now we're going to come to the portion of the show that explains what is teeth in the day. Teeth in the day is a restoration where we place a series of implants, and that day the patient leaves with permanent fixed teeth. So on this technique, what we're doing is you're going to come in my office about 9 o'clock. You're going to see the surgeon. You're going to be totally sedated, so most patients don't ever even remember being in our office. And we're going to place a series of implants. After the implants are placed, we're going to come in, and with the restoration we pre-made, we're going to have, working with our specialists and our laboratory technicians, we're going to actually place some parts on that restoration, and you're going to be able to leave about 4 hours later with permanent teeth. So that's what we call teeth in the day. When you looked at Angela's case, which is an overdenture, you might ask, what's the difference between an overdenture and teeth in the day? An overdenture is a removable restoration. It's got incredible aesthetics. It uses the Swiss dent technique to set the teeth, and if you've seen watching this show, I think you'll be impressed with how Angela looked. Now, when we do teeth in the day, we're still using the Swiss dent technique to set the teeth, but we're going to use a custom titanium or bar eventually to get you as close as we can get you back to human nature, where you have a restoration that never comes out of your mouth. So when we're looking at an overdenture versus a teeth in the day, the main difference is an overdenture has to come out a couple times a day to clean. You're basically wearing that restoration 23 hours and 50 minutes a day, but about 5 minutes in the morning and 5 minutes at night you have to take it out to clean. With teeth in the day, it's totally permanent. So when you eat corn on the cob or you eat a good steak, the restoration directly screws into the implant, so there's no force on your tissue. This is as close as we can get you back to human nature. So when you're chewing a steak, it literally feels just like real teeth. Psychologically, a lot of people don't want an overdenture because a couple times a day you have to take it out to clean, and they don't like the idea of having something that even for a few minutes a day, you see how your face collapses when you don't have real teeth. With teeth in a day, it's totally permanent. You come in my office every 6 months for a cleaning just like real teeth. It feels like exactly like real teeth. So that is the ultimate in implant dentistry, is to give a patient totally permanent teeth. So if you've been suffering with denture problems and you've ever dreamed about going back to permanent teeth, just like you had when your teeth were healthy and you were young, please call me for a free consultation. I'll be glad to personally go over in depth how we do teeth in the day, how we can get you back to permanent teeth just like you had when you were young. You know, I'd like to introduce our viewers to one of the specialists at David & Associates, Dr. Vladimir Jovic. Dr. Jovic is a prosthodontist, and you might ask, what is a prosthodontist? A prosthodontist is a specialist who's went an additional 4 years to dental school after dental school in postgraduate education to learn how to do difficult implant and reconstruction cases. So we're very pleased to have Dr. Jovic at our practice because one of the main procedures we do at David & Associates is involved complex implant cases, and Dr. Jovic has had expert training in doing complex dental cases. And so we also have a patient that Dr. Jovic has recently finished, Randy, and we're going to show you what we can accomplish with the Swiss dent technique. So I want to have Dr. Jovic talk to Randy and go over what Randy wanted to accomplish when he came to our practice and what we exactly did on Randy.
One of the things that I do is I customize a plan. That's why I went back and specialized and really got the education to really do this, because a lot of dentists out there will just do their treatment, not really focus on the patient, just treat every patient the same. Everyone should be treated differently because everyone is an individual, and I try to individualize my treatment, customize my treatment. So when a patient comes in, it's more than just, hi, how are you? Let's do this and get it done. I'm already evaluating the patient as we're talking to them, be it looking at their smile, how much they're showing, looking at their lip support, if they've lost anatomical features, bone loss. There's all sorts of things that go into this. When I met Randy, he had some previous pictures that had some really bad teeth. Then he had a denture that was made, let's say, not the best. You know, I thought I definitely could improve on it, and I think we've done that with Randy. Randy, how was your experience?
I have to say, unequivocally, it's been one of the best experiences of my lifetime. I have my smile back. I have my confidence back. To have a deep-seated childhood fear of dentistry at a very young age, and then to finally get the courage to come into David & Associates Dentistry, automatically I felt comfortable. The staff was very welcoming. I felt secure. I felt safe. After my consultation, there was no more fear. And that was before anything was even done.
That's great.
The procedure went as explained perfectly, and I cannot tell you how pleased I am to be able to eat what I want, laugh, talk, smile, have my family and friends tell me what a beautiful smile I have. It's really given me my life back and my confidence back, and I'm so grateful.
You know, I think, you know, Randy's on the show because he wrote us a wonderful letter about how it changed his life. And what we try to always accomplish is we want form, and we want function, and we want aesthetics. So it's, you know, you can have aesthetics, but if you don't have incredible function, you still haven't accomplished, you know, what we want to accomplish. And that's what we're very lucky to have Dr. Jovic in the office, because as you can see from Randy, I think he's got an incredible smile, and as I think we'll show you his old restoration, it was an incredible change.
Absolutely.
You know, what were you trying to accomplish, you know, when you looked at Randy, and we've obviously seen his old restoration.
Oh, yeah.
And so what did you change? How did we get this incredible transformation?
So when Randy came in, it looked like the smile that he had, he was showing a lot of lower teeth, which you see that kind of mimics older age when you have that. I wanted to give him a subtle look. I didn't want to give him something where he's showing too much. You know, give him some nice lip support, and we can change things, not only just your teeth, but how your smile looks, how your facial profile looks. There's so many things that can be accomplished with this, but it takes the right evaluation. And, you know, that's what I do. And there's multiple appointments that we do this in. And no matter what, let's take the time to do it right. There's no rush into getting you a beautiful smile, so let's do it right.
Yes.
You know, I like to shake hands. I'm an outgoing guy.
Yep.
I like to look people in the face and project a confident image. For years, I just haven't been able to do that. It was like this. I couldn't laugh. I couldn't be a part of. Now, I have absolutely 100% confidence in going right up to people, big, beautiful smile, introducing myself, it's just totally changed my life.
Really, with the Swiss dent technique, it's taken into account the patient's age, the sex, the facial profile. When we see patients coming in with dentures, what we're usually seeing is this flat, typical denture look. Real teeth aren't set flat. The bites overclose, so when you look at their facial profile, it ages them. Or what happens is when a patient loses their teeth and you don't communicate to the laboratory technician where you want the facial profile to be, all of a sudden the lip collapses, and that's why a denture can age you 10 years. So we've had many people tell us with this Swiss dent technique, it looks like they've had a facelift or a cosmetic surgery, because we really pay attention to how the facial profile should look. It's not just having the teeth look good. What you can do with the Swiss dent technique is really build out the patient's lip. You can fill out the nasolabial folds. In my practice, we do a lot of cosmetic fillers, Restylane and Juvederm. And with Restylane and Juvederm, we can get this look, but it lasts maybe 7 months to 12 months. But with a Swiss dent restoration, because we built the facial profile out permanently, this never goes away. So besides giving you a beautiful smile, I think when you look at Randy, what Dr. Jovic's accomplished, and what you saw from Angela, the patient that I recently finished, we can make a remarkable change in your facial profile, not just the smile, and we can also give you back the function so you can chew the food you want to chew with.
I wouldn't be afraid to pick up anything and eat it if it tastes good and if it's what I wanted. It's just that confident in my teeth, and it's just it's an awesome feeling.
Well, thank you.
It's almost undescribable.
Well, we appreciate having you on the program today. Thank you very much.
It's been a pleasure,
Thank
sir.
you, Dr. Jovic.
Thank you,
You know, after doing dentistry for 30 years, I found patients fear two things: pain or discomfort, and can I afford quality dentistry? I'm going to introduce you to 3 of my most trusted staff members that can help patients just like you fit the dentistry you need into your budget. You shouldn't have to be rich to enjoy the pleasures of biting into an apple or eating a good steak and not having your teeth slip or cause you pain. You shouldn't have to be rich to be able to go out on a date or to church and worry that people are looking at your teeth for the wrong reasons. So let me introduce you to Tracy, Mandy, and Lindsay, my financial coordinators, and what they can do for you and how they can help you eliminate your problems and be able to enjoy life. I'd like to introduce Mandy and Lindsay, my treatment plan coordinators, explain what they do, how they can help patients like you accomplish a better smile and function. So again, this is Mandy. Mandy, explain to our viewers what you do at my practice and how you help patients get the smile that they want and deserve.
Right. A lot of people come in and they're not quite sure how they're going to achieve that beautiful result that they've always dreamed of. When they come in and speak with me, we look at their budget, we look at what's within reason with them, and we kind of put a plan together to make this treatment affordable for them. Now, keep in mind, a lot of our plans are interest-free, and we can extend them as long as needed for the patients to make it affordable. And we do work very closely with the insurance to kind of play out the benefits and also use their yearly maximum.
When you're watching this show, you have the overdenture option, which is our most affordable option. You have the all-on 4, which are our permanent teeth, and we actually do custom bridges. So, again, go over, when a lot of patients come to me and they've seen the show, they'll come up to me and they'll say, there's no way I could afford this. But again, go over basically how we have a lot of just average people that they've suffered from denture problems for years and how you've helped them be able to put this in their budget.
Absolutely. We always start with trying to get the immediate effect. And a lot of times, it's not, most of our patients are your average people every day that they're having the same issues. And it's very common. And we have come up with ways to basically explain to them how to phase it out, how we can start with this and we can always go to something else later. If they want to, in a couple years later, upgrade to, the all-on 4, or upgrade to the upper bridge or something. Yes. We always discuss those and we give them the options to say, hey, this is going to be your immediate result within your budget. We can do this later, or we can always work, like we talked about with, like Mandy was saying, with the insurance. A lot of patients, they have about $1,000 to $2,000 maximum. So we try to see about their plan year. We try to see what we can get done in that maximum, and then we can try to start the treatment and then try to get it to finish around the time the benefits reset. So then they would have their next year maximum to use towards that. We always discuss in-house financing, what we can afford to do for the patient for them. And then we also discuss, like she was saying, with the care credit we use. A lot of these plans are making it more affordable for patients to do it. And they come in having no idea that they can actually use these options to put towards their treatment.
So, and this is what I'm delighted to have, 2 excellent people that can help you after you come in for a consultation. I think you'll be surprised how we can work an affordable payment plan into your budget where you don't have to suffer with dentures.
You are witnessing this beautiful young lady transform from wearing an unattractive, ill-fitting denture to a beautiful smile supported by dental implants. Imagine this being you. Our Teeth in a Day program will miraculously give you permanent teeth the same day. At David & Associates, everyone can enjoy a beautiful smile, properly eat food without pain. Call David & Associates and get started with a free consultation and CT scan and enjoy life to the fullest. Call David & Associates and get started today.
You know, I'd like to introduce our viewers to Tracy, my office manager. I've been honored to have her working in my practice for a number of years. She's really helped me build my practice and to help patients fit implant dentistry into their budget, to streamline their care, to make sure that the medical clearances are done, that their scheduling is done properly, to receive exceptional customer service. So again, this is Tracy. Tracy, explain to our viewers some of the procedures and what you do at David & Associates and how you help patients.
Well, just like Lindsay and Mandy said, that we try to make it work into their budget, make it comfortable payment for them, and we do offer the interest-free options, and we facilitate any medical clearances that they may need. We offer convenient hours, and we have many doctors in the office that can fit their needs. So if they need something other than what they expected and the treatment is not, or excuse me, if the treatment is something that we can do for them, then we have many doctors that can facilitate that for them.
Yes, you know what Tracy does is after they meet the doctor and they get the options, they see our financial coordinator. And if the patient feels that they want to go forward with a treatment plan, Tracy is really the ultimate coordinator to make sure that they're going to see the right specialist. If they're going to see a prosthodontist, which is the crown or bridge implant specialist, if they're going to see the surgeon, she's going to make sure that the medical clearance is done. You're going to really, the patient is really going to get to know Tracy because she really goes out of her way to ensure exceptional customer service. I've been really pleased to see how from start to finish you make sure that the patient is really pleased with their total care.
The most important thing is to make sure that the patient is happy with the care that they're receiving, with the doctors that they're put with, down to the assistants that they're working with. If the patient is happy, then everybody is happy, and that's my job to make sure that everyone is pleased with what's being done, pleased with their financial arrangements, and pleased with the final result.
I just wanted you to let you see the kind of people that you're going to meet at my practice. And again, one of the first persons you're going to meet at David & Associates when you come in for an implant consult is Tracy. She's going to take you through a tour of the office. You're going to see the surgery center. You're going to see where we restore the implant. You're going to see our in-house laboratory. You're going to feel absolutely comfortable before you do any treatment at David & Associates. And one of the reasons you're going to feel very comfortable is because of the experience that I'm lucky to have with Tracy. Thank you, Tracy.
If painful dentures or your teeth prevent you from enjoying one of life's great pleasures, like eating great food, David & Associates offers a solution, a life-changing procedure called Teeth in a Day. Come to David & Associates in the morning for implants and leave with permanent teeth the same day.
Life's too short not to enjoy it. Call David & Associates for a free consultation on a revolutionary procedure that can give you a dazzling smile and change your life. I hope this program informed you of how David & Associates can help you if you have denture problems or many broken or painful teeth. My practice is one of Florida's largest, oldest, and most experienced multi-specialty practice. Call me for a free consultation. What do you have to lose except those ill-fitting dentures?